this afternoon I'm going to talk about hypertension in pregnancy. I mean high blood pressure during pregnancy. As we know that hypertension, because I'm going to repeat that term again, hypertension means increasing the blood pressure for the patient. Hypertension may cause a lot of trouble to the pregnant ladies. First source of trouble that it may cause abortion. Second, it may cause stillbirth. I mean the baby may die inside the uterus due to intrauterine growth retardation. What do you mean by intrauterine growth retardation? I mean when the blood pressure is high, the blood vessels, the wall of the blood vessels contract. The amount of the blood which goes to the baby is less. The baby will not grow well. This is what I mean by intrauterine growth retardation. And if intrauterine growth retardation, it carries on for a long time, or the spasm of the blood vessels is too much, this means it may kill the baby inside the uterus. Inside, I mean. Situation like that led us to feel that hypertension in pregnancy, it is quite dangerous, either for the mother or for the baby. As we know that hypertension during pregnancy, it may be due to that the patient knows that she is hypertensive due to one factor or other. What do you mean by one factor or other? Unfortunately, I found that a lot of the patient having treatment for hypertension without knowing the cause of the hypertension. Unfortunately, I can find some of the patient having treatment for hypertension without knowing the cause. Situation like that is quite dangerous because we should diagnose what is the reason for the hypertension, not to go straight to the pharmacy or to go straight to the doctor and please take that medicine or the other medicine and the blood pressure will be dropping to normal and oh, I'm having successful treatment. That's rubbish. Because we should know first what is the reason for the increasing of the blood pressure. Increasing blood pressure, or I mean hypertension, may be due to changes in the blood vessels wall. It may be due to renal failure, kidney functional failure. It may be due to renal artery stenosis. I mean by renal kidney artery stenosis. It may be due to tumor above the kidney, what we call it pheochromocytoma. It may be to quite few other diseases. And the treatment here, we should treat the cause rather than carrying on for treating the symptoms only. Situation like that, if we say hypertension in pregnancy or hypertension alone, when we find no cause, we call it essential hypertension, and we start the empirical treatment by beta blocker or by methyl dopa or all other medicines. Let us go for the hypertension who developed during pregnancy, what we call it preeclamptic toxemia. Usually it starts after 20 weeks of pregnancy. The patient is quite normal all the way through until it comes after 20 weeks, we find that the blood pressure is going up. Situation like that is quite difficult because we don't know the cause until now. We are trying a lot of theories about it. May be due to the hormones of the pregnancy, may be due to toxins secreted by the placenta, and all of that, nothing has been proved 100%. But anyway, treatment nowadays is quite different than the treatment before. As I said, that treatment for the non-pregnant ladies is not advisable to be a first line of treatment for pregnant ladies. Why? We found that high incidence of intrauterine growth retardation, I mean the baby is not growing well inside the uterus. And all the group which working through the CNS, does the same effect. The other group of medicine, which is a beta blocker, which drop the blood pressure by making vasodilatation, I mean dilating the wall of the blood vessels, increasing the blood which is going to the baby, That's okay, but it's not good again because it drops the heartbeat of the mother and the heartbeat of the baby. And we will not know if the heartbeat of the baby is slow due to that he's in bad condition or slow due to the medicine. Nowadays, treatment has been changed completely for the pregnant ladies using beta-sympathomimetics. What do you mean by beta-sympathomimetics? All of us know that the patient who had an anginal attack, heart attack, will give him tablet under the tongue. What is the function of this tablet? It dilates the wall of the blood vessels and it allows a lot of blood because anginal attack is due to a spasm, I mean by spasm contraction of the blood vessels. The blood which goes to the heart is much less and the patient has an anginal attack. To relieve it, he takes the tablet under the tongue, and the tablet under the tongue, it will dilate the blood vessels, increase the amount of the blood to the heart, anginal attack is over. Professor Campbell in United Kingdom discovered that this source of treatment for the anginal patient could be very helpful for the hypertensive lady, pregnant ladies. What do you mean by that? We know that sublingual tablets nowadays are developed by the pharmaceutical company as skin patches working for 24 hours, which is called either 5 milligram or 10 milligram. It doesn't make, the doctor will decide how much do you use. Skin patches for 24 hours. It dilates the blood vessels for 24 hours. And it has a very good effect, dropping the blood pressure to normal, increasing the blood supply to the baby. This means it will be no risk for intrauterine growth retardation, decreasing the risk of the preterm labor as well, because once we develop intrauterine growth retardation, the patient may develop preterm labor. And we means that the dangerous or the risk of the preterm labor, that the baby may go to the special care baby unit, the incubator, he may live, he may not. By using the, and that's a new trend in medicine, by using, and I mean glyceryl trinitrate, making the blood vessel dilated all the time, and the smooth muscles of the body is dilated all the time. This means it puts the uterus in relaxing condition. This means it prevents preterm labor, it prevents intrauterine growth retardation, and it drops the blood pressure. If this one, it will work alone, that's much, much better than using the other source of medicine which we used to have all the way through. Let me stress on the point of, don't start the treatment without investigations. Investigations will be done by doctor. He will decide what source of treatment you should have. If your treatment will be 1 tablet daily, you may be able to fast. If your treatment is 1 tablet 6 hourly, you will not be able to fast for your own sake and for the sake of the child. Thank you.